The alignment gauge plays four critical roles in ensuring the TOPS implant is positioned correctly and therefore functions properly. First, the tool serves as a decompression template. Second, it assists in aligning the dorsal height of the pedicle screws. Third, the gauge, when positioned in the midline, confirms same left-right interpedicular distance. And finally, the tool signals whether the implant will improperly lean to one side or the other. Each function is critical for the longevity of the implant, but none of these critical functions will work properly unless you lock the set screws on the alignment gauge arms. Decompression template. Make sure that the alignment gauge drops easily into the tulips and that the arms sit flush with the tulip heads. Also, confirm that there is a gap of a few millimeters between the implant and the superior spinous process. Dorsal height alignment. Dorsal height alignment is essential because the internal spherical components of the TOPS device must move smoothly over each other. This articulation is only possible when all four pedicle screws are aligned on the same plane. What happens if one screw is misaligned? When you forcibly tighten the set screw of non-conforming pedicle screw, the device will be twisted. The twist causes a reduction contact area between the articulating surfaces, resulting in accelerated wear. Even small deviations can affect long-term performance, so getting the alignment correct by locking the set screws is critical. These confirmations are only reliable if all four set screws are securely tightened. Tightening of the set screw applies approximately 100 kilograms of force. In contrast, pushing down on the alignment gauge arms by hand provides no more than 5 kilograms of force. This difference is critical. If the set screws are not fully locked, the rods may appear properly seated but may actually be misaligned or blocked by soft tissue. Small discrepancies will cause malpositioning of the implant and potentially compromise articulation and reduce the lifespan of the device. Left-right symmetry. If the interpedicular distance between the left and right sides is unequal, resulting in a different size implant on the left and right side of the alignment gauge, the set screws of the upper arms must be loosened, but not removed and manipulated caudal cranial, while slightly rotating to achieve the same value on both sides. Confirm it is centered. The alignment gauge also ensures the implant is correctly positioned, side to side and front to back. When placed correctly behind the disc, the TOPS device aligns with the patient's native center of rotation. The confirmation must be made using a lateral fluoroscopic image. The gauge's main longitudinal line should sit within an imaginary posterior extension of the disc space area. Why does this matter? Offset or tilted placement may lead to asymmetric motion and potentially accelerated device wear. To conclude, always confirm that the alignment gauge drops easily into the tulips and that the arms sit flush with the tulip heads. Verify dorsal height alignment, so all four pedicle screws are on the same plane, and check for equal left-right interpedicular distance. Confirm proper alignment with the disc using lateral fluoroscopy. Most importantly, lock the set screws on the gauge arms. Without this step, none of these checks will work properly, and implant performance may be compromised.